Can you take CoQ10 with a statin? Short answer, yes. These are generally safe to take together. But here's the part most people miss. The real question is not whether CoQ10 is safe with your statin. It is whether it actually helps with those muscle aches you are trying to fix. And the honest answer is, the evidence on that is a lot more complicated than most people realize. I am Steve, a pharmacist. On this channel, I break down supplement and drug interactions using real evidence, not clickbait. Let us get into it. So here's why CoQ10 and statins come up together so often. Statins work by blocking an enzyme called HMG-CoA reductase. That enzyme sits at the top of something called the mevalonate pathway. And that pathway does not just make cholesterol, it also makes CoQ10. So when you take a statin, you are lowering your cholesterol, but you are also lowering your body's natural production of CoQ10. That is not a theory. That is established biochemistry. Now, CoQ10 plays a big role in how your mitochondria produce energy. So researchers looked at this and said, maybe the muscle pain some people get on statins is happening because their CoQ10 levels are dropping. That is a reasonable hypothesis, and it is why so many people start taking CoQ10 when they develop muscle aches on a statin. But here is where it gets tricky. When you actually look at the clinical trials, the results are split. Some meta-analyses found that CoQ10 supplementation improved muscle pain scores compared to placebo. But other high-quality reviews, including one in Mayo Clinic Proceedings, found no significant benefit. And the National Center for Complementary and Integrative Health states that the overall evidence does not support CoQ10 as a reliable solution for statin muscle pain. So the honest pharmacist answer is this: the biochemistry makes sense, but the clinical proof is inconsistent. There is one more thing worth knowing. Statin-associated muscle symptoms are not always straightforward. The National Lipid Association points out that muscle complaints are actually common in the general population even without statins. So sometimes what feels like a statin side effect may not be one. That is why proper evaluation matters more than just adding a supplement and hoping for the best. So what should you actually do? First, if you are having muscle symptoms on a statin, do not just grab CoQ10 and call it done. Talk to your doctor or pharmacist about whether those symptoms are genuinely statin-related. There are other causes like hypothyroidism, vitamin D deficiency, or drug interactions that need to be ruled out. Second, if your provider agrees it is worth trying, CoQ10 is reasonable as a trial. Take it with food since it is fat-soluble, and that helps absorption. Third, watch for red flags. Severe muscle pain, dark-colored urine, marked weakness, or fever with muscle symptoms are signs of something more serious and need immediate medical attention regardless of what supplements you are taking. And fourth, if you are on warfarin, mention CoQ10 to your prescriber before starting. There is a potential interaction there that is worth monitoring. Here's the bottom line. CoQ10 is safe to take with statins, and it is reasonable to try if you are dealing with mild muscle symptoms. But set realistic expectations. It is not a guaranteed fix. The most important thing is making sure your muscle symptoms are properly evaluated and that your statin therapy is managed correctly. That matters a lot more than any single supplement. The full guide with references is on LiveHealthyRX.com. Link is in the description. If this was helpful, consider subscribing. I cover these kinds of supplement and drug questions every week.